Hi, Troy. Do you remember me? I'm Christy. I was your nurse the last time you were here.
I think.
Awesome. So we checked your vitals before you came in, okay? So you were 165 pounds. You were 6 foot even. We got your heart rate, which was 70. Your respiratory rate was 16. Your pulse ox was 100%. Your blood pressure was 120/68, and you were 98.2 degrees Fahrenheit orally. That was your temperature, okay? So all your vitals are normal. We check those just to make sure nothing's high, nothing's elevated that we need to be concerned about, okay?
Okay.
So the very first thing that we're going to do, I'm going to ask you to take off your socks, okay? I'm going to touch your feet in the back of your leg. Those are your distal pulses, okay? This exam's only going to take about 10-15 minutes or so. So go ahead and take off your socks for me. Go ahead and undo your shirt while I'm doing this, okay? So I'm just going to mess with your feet. Go ahead and just, as I'm messing with your feet, I'm making sure that everything looks good with his feet. He's got hair growth. His nails look good, other than just a little bit of irregularities because he works outside, wears boots, that kind of thing. So I'm going to feel back here. You have another pulse back here, which a lot of people don't know about. So his feet look good both ways. Your pulses are nice and strong on both feet. Everything looks great there. So your distal extremities, they're warm, they're good. You have a 2+ pulse, which is strong and it's not bounding. It feels normal, okay? Which means you have some pretty good circulation in your feet. Everything looks good contour-wise. You can also do the femoral and the popliteal arteries, but I'm not going to do that because that involves him taking off his clothes and that kind of thing. So what I'm going to do is I will auscultate the arteries whenever I do the abdominal assessment. So, Troy, go ahead and lay down for me.
Shirt on, shirt off.
Shirt off, please.
Thank you.
You're welcome. Okay, so what I'm looking for now is any jugular pulsations, any pulse waves in the jugular. You look pretty comfy there, Troy. So go ahead and put this arm up, put this arm down like that. Go ahead and straighten your neck out for me so I can see it a little bit better. Awesome. He doesn't have any JVD. I'm going to auscultate the artery there for a bruit. That would mean that there would be something up with your artery there, Troy. So I'm just going to make sure it doesn't have anything called a thrill, okay? It does not. It sounds normal. So that being normal, that means everything is good that way, okay? So I inspected your peripheral veins and arteries for sufficiency in your legs. Everything looks good. I'm going to look at your arms, okay? It looks like you have some pretty good veins in your arms. I'm going to feel your artery here. You have skin. You don't have any nail changes other than just that you work outside and stuff. We went over this already. Everything looks uniform. Your pulses are 2+ in both of your arms. In your radial artery. So looked at skin, the texture, the color looks normal. Nail changes, he doesn't really have any nail changes. Hair changes, he doesn't have any muscular atrophy, any edema, and any varicosities in his legs, anything like that, or even in his arms. So I palpated his extremities for warmth. They're very warm. His pulse quality is a 2+ in everywhere. They're not tender. He doesn't have any pitting edema, anything like that. So next we are going to do your abdominal assessment. So you're laying just normally with a pillow under your head and your arms at your sides. So go ahead and lift up your shirt for me. So I'm going to listen to your belly and press around, okay? It might feel a little bit uncomfortable. So just looking at his stomach, he's got a hairy stomach. It looks like he's got a scar, but we had went over that he had had abdominal surgery at one point in his life. So everything looks good with his venous return. Everything's symmetrical. Surface motion is fine. So next, I'm going to auscultate all 4 quadrants, auscultate those arteries, and then we're gonna go ahead and press on your belly a little bit, okay? That would be the percussion aspect. So I'm gonna get down to his level here. I'm also gonna be looking at the tone of his stomach. It doesn't look like he has any issues. It's flat, it's not rounded, anything like that. His breathing looks normal. So I'm just gonna go ahead and listen. I'm gonna go down a little bit lower just to listen to your femoral. Okay, so I listened to all of his arteries. They sound fine. The aortic, the renal, the iliac, the femoral arteries. And with that, I could hear all of his bowel sounds. They were active and equal in all quadrants. So next I'm going to percuss your abdomen, okay? So what that means is I'm going to be feeling it.
Okay.
So, does that hurt?
No.
Okay, so as I'm pressing on his belly, I'm gonna watch his face, make sure he's not having any tenderness or anything. You want to press kind of firm just in case he would be ticklish. Next, what I'm gonna do is I'm going to try to palpate his liver. So there's a couple different ways that you can do this, but what I'm gonna do is I'm gonna take both of my hands and I'm gonna kind of go up, because it can kind of be hard to feel the liver. Oh, there it is. But his liver borders feel nice and contour. It doesn't feel enlarged to me. The next thing I'm going to do is I'm going to check for his spleen. So Troy, what I want you to do is kind of turn a little bit on your side here, kind of with this side up.
This way?
No, this side up. Just a little bit, okay? So I'm going to pull this, and then this might feel a little bit weird. Does that hurt?
It's weird.
It does feel kind of weird, huh? So typically you don't feel the spleen. That's okay. I did not feel his spleen. That's kind of normal for that, okay? That's fine. But we always try to do that. I don't feel any crepitus or anything. Actually, I'm going to need your stomach again. So I already did light palpitation. What I'm going to do is some deep palpitation, just making sure that I don't feel any masses or anything. So, does that hurt? Or just
No.
feel weird? Okay.
Feels different.
Yeah, it does feel different. So I'm going in a swirling motion. And everything feels fine. I don't feel any masses, any bulges, anything like that. So I would also be looking to make sure he doesn't have any hernias, any masses, any enlargements in his belly at all. His umbilicus looks fine, which is your belly button. It looks like he does have a little bit of scarring there. He has had a couple other surgeries, so there are some scars there too. So we felt his liver and liver border. He doesn't have a gallbladder. He told me that with his assessment that I did on him. So I did the spleen. I'll look for his kidneys here in a little bit. I don't see any aortic pulsations. We listened to the aortic artery. It didn't sound bad. There was no bruise, no other masses. And then I think that is about it. Go ahead and sit up for me. You can go ahead and put your shirt down. Okay, and as he's sitting up, I want to make sure that his muscles and stuff are good. He doesn't have any hernias, any separation. So what I'm going to do is I'm going to percuss the cerebral-costal angles for kidney tenderness next. So I'm going to lift it up to the back of your shirt, okay?
Okay.
So if you would have a kidney stone or a kidney infection, this would hurt. So I'm going to percuss. A lot of times they say like you're feeling like you're jumping out of your skin whenever you percuss these. Does that feel okay?
Yeah, it feels fine.
Good. Well, I guess you don't have a kidney stone or anything, okay?
Well, I guess that's good, doesn't it?
Yeah. Do you have any other questions about anything, Troy?
I don't think so.
Okay, well that wraps up our assessment. You have a great day, okay?
You too.
Thanks.